Issue.
Arlen Specter's been too liberal for too long.
NBC 10 at issue, Sunday, August 30th. 5 years ago, Pat Toomey nearly ended the storied political career of Senator Arlen Specter. Now, Toomey runs again for U.S. Senate. What would he do on health care reform? How will he campaign against Specter or Joe Sestak? Now, on NBC 10 at issue. Good morning. I'm Steve Highsmith. Patrick Toomey, raised in a union family, educated at Harvard. He worked in finance and then went into the restaurant business. Toomey served 3 terms in the U.S. Congress representing the Lehigh Valley. He almost defeated Senator Arlen Specter in the Republican primary of 2004. An average of recent polling puts him ahead of both Arlen Specter and Specter's Democratic primary challenger, Joe Sestak. With me now is Republican candidate for U.S. Senate, Pat Toomey. Congressman, thanks for being here.
Hi, Steve. Thanks for having me.
Let's begin with Senator Edward Kennedy. Senator Kennedy laid to rest this weekend. You seek to be a senator.
Right.
What do you think of him now?
Well, as I've always thought of Senator Kennedy, he, I think, earned his reputation as a very hard-working senator. It's a sad moment when the last of a generation of an iconic family passes, as he has. I didn't agree with his politics, but I respect the fact that the man was committed to a set of ideas, and he worked hard to try to advance those ideas.
Even in the immediate aftermath of his death, many critics of him, some of whom are probably supporters of yours, have reviled him, have said very nasty things. Do you have anything that you would say to them?
Well, I would just hope that the tone of our politics could avoid the nasty element. It's perfectly legitimate for people to have strong disagreements, and we ought to express those opinions and disagreements, but I hope we can do it in a civil tone.
That leads us to health care. These town hall meetings, which are more question and answer sessions than pure town hall meetings, have in many cases been very boisterous, very passionate. Do you look at it as any kind of sign of something, or do you see it as the left doing what they were doing under the Bush administration? In other words, the right is out there now making a lot of noise at these town hall meetings. When President Bush was in office, the left was making a lot of noise, and the two were just sort of yelling at each other.
I see it very differently, Steve. I think that the cumulative effect of this extremely overly ambitious left-leaning agenda coming from Washington with one party, the Democratic Party, in complete control, has really touched a nerve with ordinary Americans. It's the cumulative weight of all the bailouts of this massive stimulus spending, unprecedented deficits, huge debt, nationalizing the car companies, tax and trade, and cap and trade, and now health care, which is so personal. And this bill is so badly flawed. I think there's a lot of ordinary Americans. This isn't just people on the right. These are ordinary Americans who are saying, wait a minute, this is just too much. They're going too fast. And that's what I think we're seeing at the town hall meetings.
Would it be a mistake for Republicans to look at these town hall meetings and the anger that is at some of them directed at members of Congress and think that that automatically means that that's support for Republicans?
It would be a mistake to conclude that, I think. I think that it's an opportunity for Republicans to provide some leadership on health care, because we need to make some serious reforms to our current health care system. I think most Republicans understand that. It's not enough to just be against whatever the Democrats are for. That's not leadership. But this particular bill is very badly flawed, and the American people understand that. A big majority of the American people don't want to see us go down the road that this bill would take us, with really a government takeover of health care ultimately. So I think Republicans need to stand up for an alternative.
But Democrats will say that while it does appear by polling that most Americans are not in favor of that House bill 3200, that they, in many cases, are against it either because they were already predisposed not to like anything the Obama administration or Democrats were going to do, or two, that they have a lot of misinformation. For example, the going into your checking account being not true, or the death panel, being hyperbole.
You don't need misinformation to have real serious concerns about this bill. I mean, just look at the things that CBO has said about it, the Congressional Budget Office. This is obviously a Democrat-appointed Congressional Budget Office since the Democrats control. It's over $1 trillion in cost. I mean, that's a staggering amount of money to anybody. It has a government option, and it's designed in a way that even left-of-center groups, I mean, the Lewin Group has said that could drive over 100 million people, Americans, off their private plans into a government plan. It raises taxes enormously on small businesses, on individuals. It intrudes, and this is something that I think is very problematic for a lot of people. It really intrudes on the relationship between a patient and the doctor. When the government sets up a plan and decides it's got to control cost, how's it going to do that? It's going to start making decisions about health care, and I think most people feel that ought to be between themselves and their doctor.
Where does the credibility come in on the part of the Republican Party on this issue, though, in the sense that over the last 8 years, the Republicans did not put forth a credible healthcare cost savings plan, did not try to get the other 46 or 70 some odd million underinsured or non-insured people insured. So if someone comes back and says, you're only saying the things you Republicans are saying now because you're trying to counter the Democrats, but you're not really serious about doing what you want to do.
Oh, I don't think that's true. I think, well, I mean, maybe about some Republicans, but many of us have been calling for substantive changes for a long period of time. Now, first of all, I think you need to acknowledge people can throw around the number of 46 million, but if you start to look at that, actually a very substantial portion of those folks already qualify for a government plan, either Medicaid or S-CHIP. A significant number, again, according to the census, actually are on Medicaid, and they misreport. A big number, a big chunk, according to the Congressional Budget Office, are only going to be uninsured for a period of no more than 4 months. Mm-hmm. So when you start to look at where is the problem, and there is a problem, there's a group of Americans who are chronically have trouble getting insurance, but it's a relatively small number. We should absolutely have programs to help those folks, but we shouldn't turn the whole system upside down because of that relatively modest percentage of folks who have problems. So Republicans, at least this Republican, has long advocated we ought to do things to limit the cost, right? Escalating costs are one of the biggest problems with health care in America. Well, one of the things you do is you have more competition, right? I mean, the Democrats are right about the need for more competition. I think where they're wrong is thinking that the only real competition is a government-run plan. I'd like to see us allow competition across state lines.
And why is that?
Because it would introduce a whole new range of options for Pennsylvania families. Plans that are regulated by other states, some of which would have fewer mandates, and that means lower cost. And I think a Pennsylvania family ought to be able to make that decision.
Well, let's stop right there. The fewer mandates. There are some states that would say, well, we have more mandates because we want to make sure people get extra care. And if people would buy a plan in another state, they wouldn't have the same level of protection or care. Is that false?
And the question is, who should make that decision? Why shouldn't the family decide what level of care they want to pay for, and how many mandates they want to live with?
Well, what the government comes back and says, or Democrats come back and say on this, is that X number of millions, whether it's 15 million or 46 million, whether it's uninsured or whether it's underinsured, when they get in big trouble, particularly younger people, they're in the emergency room. The country winds up paying for this anyway. It's the old same argument with cigarette smoking and taxing it. Right. So the thing is that if they don't have adequate insurance, taxpayers are still going to pay for it anyway.
Well, and I want a lower cost so that people can afford the insurance. I mean, I'm arguing that the main reason most people who truly need insurance and don't have it is because it costs too much or they have a pre-existing condition, and we need to address both of those.
I'll pick up on this more with Republican Pat Toomey in a moment on NBC 10 at Issue.
You're watching NBC 10 at Issue.